Welcome to Let Me Fix This. Enjoy the video.
You begin by securing a legitimate prescription and a clear medical indication. Do not self-prescribe. Once you have that, schedule baseline blood work, CBC, liver function, lipids, testosterone, and PSA if applicable, so you know the starting point. Make sure to review the list of contraindications with your clinician, especially liver disease, prostate issues, or pregnancy risk. Immediately adjust medications that interact and document allergies. This establishes safety parameters before any dosing decisions are implemented under medical supervision. You follow the prescriber's exact instructions for timing and relation to meals. Consistency matters for predictable absorption. Once dosing has started, arrange frequent monitoring, initial liver tests weekly, then monthly, plus routine lipid and blood pressure checks to detect toxicity early. Make sure to log symptoms like jaundice, significant mood changes, fluid retention, or unusual bleeding. These indicate urgent reassessment. If you experience severe side effects, stop and contact your provider immediately. Keeping close communication with your clinician prevents complications. You complete therapy only under clinician direction. Abrupt cessation can cause hormonal imbalance, so make sure any taper or stop plan is supervised. Once the course ends, obtain repeat labs to confirm liver recovery and hormonal normalization, and ask for an endocrinology referral if recovery is delayed. If you notice severe adverse events, yellowing skin, severe abdominal pain, chest pain, or rapid mood swings, stop immediately and seek urgent care. One troubleshooting tip: persistent abnormal labs require stopping the drug and expedited specialist review.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.